Do people choose? I know for me there was no choice. That was the surgery that there was.
Okay.
And I'm very glad that there was that. Do people choose, or is it almost as if the surgery chooses them? I hate to say that, but
No,
sort of vice versa. How do they choose?
Okay, this is actually very common. Most of the time nowadays, all the overweight people are so well read. They have done so much research. It's unbelievable the network that is out there. They come into the office having internet, newspaper, articles. I mean, they're already predetermined. So they walk into my office and they say, I want the band. We have to go, I mean, through both operations. But most of the times, in answer to your question, they come in, they're too scared of the bypass. Or they don't want the band. I don't want this silicone thing in my thing. So this is one group of people. You have the group of people who, for their insurance, unfortunately, with their healthcare coverage, they cover the bypass, they don't cover the band. They can't afford the band, therefore they have no choice but one choice. This is the reality of our day's healthcare, unfortunately. So this is not at all an academic, proper decision-making, but it is a real part of life, because if, they cannot afford the burden, and yet they deserve to lose the weight. So you have to give them something. And then you have the group of patients who are undetermined. And what we do with this group of patients is that I tell them to come to the support groups that we have. We have nutritional, psychological, and physical therapy, pre- and post-op support group. In those support groups, they can talk to other patients. And when they talk to the other patient, then they can help determine which one they can live more with. And then obviously, if it comes at the end where they cannot make that determination, that's when I step in. And I would have by then determined whether they are liable, they're going to follow up, they're going to need counseling, they are a sweet eater, they're not going to give up the ice cream or the chocolate, and then we make the determination between the two types of operation. Okay?
Suppose the patient gets the band.
Yeah.
Couple of years pass by, they maintain their weight loss, they're feeling wonderful. Does the band come off?
Okay, this is a very common question. Number one, they say, well, can I have the band removed? The band is made to stay for, by definition, forever, if there is no problem with it. So therefore, there is no need that once you've lost the 100 pounds or more that you are looking to lose, there is no need really to go back in and remove it, because basically it's another operation, even though it's not major. But our fear is that if you go in and you remove it, they will have tendency to go back and eat again. There are instances where we put the band as a bridge. Let me explain to you. In the super obese patients who are body mass index of over 60.
So, to tell our audience, we're talking about
many
pounds.
Well, we're talking about 600, 700 pounds.
Okay.
And now, or 500 plus pounds. And now it's a little bit, I mean, not little bit, it is difficult to really do laparoscopic bypass on them. All right? In those patients, for example, it will be wise to use the band as a bridge to make them become obese, morbidly obese, from the super obese down to a body mass index of 50, and then to give them definitive procedure of a bypass. You follow what I mean? So there are instances where we use the band as a bridge to do a more definitive operation.
To get them where they need to get them where they can at least have the option of going forth.
Yeah. So that makes the surgery a little bit safer. Actually, nowadays there are other devices. There is a balloon, which is now being used in Europe and in Canada. It's an inflatable balloon that the endoscopy puts it in that gives you a fullness sensation. And that has been also being used as a bridge for the super obese to make them lose for 6-8 months some weight to make them the surgery more safe. And as a matter of fact, not to also open another subject, as you know, there are two hormones that have been detected in the world now of obesity. One is the ghrelin, which makes us secrete a lot of hydrochloric acid in the stomach and makes us hungry. And there is another one, very interesting, it's a gut hormone, PYY336. This one gives us stimulus to inhibit appetite. So it makes you not hungry.
Right.
So the belief is that hopefully in 4 to 5 years from now, if we can have those commercially in digestible form, then this will become maybe, yes. So, and that is the future. That's why sometimes if you have a young individual, back to your question in terms of determining, that if that thing comes up, maybe this is, I'm not trying to favor one versus the other at all, But then this is reversible. Then you can go and, like you said, take this out. Now you have availability maybe of a more benign pill type, secure.
You're
But this
probably
is
going to develop a
futuristic.
test that see, for people that are having a weight problem, develop a test, which one do you have more of in your system? What do you have to get rid of, right?
what do you-
One or
Exactly,
the other.
or an inhibitor, or even, you know, something digestible that can control this non-surgically. We should be less invasive than what we do, because right now we are less invasive. I
This
mean,
is
with
very
laparoscopy,
very minimally
with the
invasive.
bypass being laparoscopic, with the band being laparoscopic, we're certainly much less invasive than
Than what I
like you
had,
said,
but,
6, 7
but by
years
that
ago.
same token, it does not matter, because whatever I had done, I would do it again. I tell people it's
No,
not for
I-
everyone. I would, you know, I would certainly say that it's not, but it's so wonderful how the technology has come. But the super obese patients, Marion, I was just thinking, are there people that just cannot have? I mean, is there a point where you're so super obese you cannot have this at all?
Now, the reason you did also great, I have to give you some credit, because it's not just a surgery, because it's very important for the patient to have a proper follow-up. And even with the bypass, I'm sure you have followed the proper instructions. I mean, just to have this surgery and then not follow properly is not healthy, because that's when you get into real problems of all the things that you are aware of as a patient that can happen, correct?
Yes.
Absolutely.
I mean, if a person doesn't come up to a follow-up, they may get all the nutritional vitamin deficiencies, all the problem, all the, you know, like we said, the slippage, all the pouch dilatation, all the esophageal dilatation, all the things that require proper follow-up.
Follow-up is necessary for
absolutely,
success.
yeah.
Thanks.
So, I'm sorry.
No, go ahead.
No, I'm just saying that after surgery, exercise every day is very important. 3 meals per day, nothing in between is mandatory. With the band, you can only drink non-carbonated, sugar-free fluid. With the bypass, you can snack, but on protein, because you need this 64 to 100 gram of protein per day. This is important. But 3 meals per day, you have to eat slowly, you have to chew properly, you have to immediately, as you feel full, stop. Don't drink with your meals. Wait 1 hour after your meal before you drink. And when you are going to drink, again, non-carbonated, no sugar, and no calorie fluid.
This is not an easy process, and I'm sorry to tell you that our time is like right at the very end. But I think that we're really not finished, and I think maybe we should have a follow-up, because I think Ro and I have some more questions for you. But I want to thank you for taking the
Thank you.
time. Thank you for coming.
Thank
You
you.
for enlightening us and our audience. And I want to say thank you to our audience, and I hope they enjoyed the show as much as we did in having you here. So
Thank you.
we'll finish this up again another
Thank you very
time.
much.